Hi everyone, today we will learn about therapeutic stretching. So today, at the end of this topic, participants should be able to define therapeutic stretching and manual passive stretching. Secondly, describe principles of therapeutic stretching and perform manual passive stretching technique. Let us take a look at the definition first. Therapeutic stretching, as general, is defined as to describe any therapeutic maneuver designed to lengthen or elongate pathologically shorten soft tissue structures and thereby to increases range of motion. Next, manual passive stretching is referred to a type of therapeutic stretching that allows a patient to relax, while a manual external forces lengthen the shortened soft tissues. Next, we are going to learn about its basic principles. In general, the aims of this stretching are to regain or re-establish normal range of joint motion and mobility of soft tissues that surround a joint. Specifically, the aims of this kind of stretching are prevent irreversible contractures, which is a shortened soft tissue problem. Increase general flexibility of a part of the body prior to vigorous strengthening exercises. Prevent or minimize risk of musculotendinous injuries related to specific physical activities or sports. Not all types of shortened soft tissue we can apply this stretching. So, be careful. Be careful with this condition and situation. Don't passively force a joint beyond its normal range of motion, like this. Newly united fractures should be protected by stabilization between the fracture site and the joint where the motion takes place. Known or suspected osteoporosis. Avoid vigorous stretching of muscle and connective tissues that have been immobilized over a long period of time. For example, someone who has been in immobilized cast, such as plaster of Paris or POP, for 4 weeks. If patient experiences joint pain or muscle soreness lasting more than 24 hours after a session of previous stretching, and next one, edematous tissue, which is swollen tissues, overstretching weak muscles. Next, do not apply and do when a bony blocks limit joint motion. After a recent fracture, whenever there's evidence of an acute inflammatory of infectious process, which is characterized by heat and swelling in or around joints. Whenever there's a sharp acute pain with joint movement or muscle elongation. When a hematoma, which sign of bleeding, and bruise or other indication of tissue trauma is observed. When contracture of shortened soft tissues are providing increased joint stability and increased functional abilities.
Now, we take a look at its general procedures. Prior to initiation of stretching, explain to the patient that it is important that he or she be as relaxed as possible throughout the procedures. Position patient in comfortable and stable position. For example, a situation given, we want to stretch triceps muscle. The position is in sitting on chair with forearms supported on a table. Free the area to be stretched of any restrictive clothing, bandages or splints. When applying the stretch, grasp firmly proximal and distal to the joint where motion is to occur. Firmly stabilize the proximal segment manually or with equipment and move the distal segment. Apply stretch force in a gentle, slow and sustained manner. Move the extremity slowly through the free range to point of restriction. Hold for 15 to 30 seconds or longer in the stretch position. Gradually release the stretch force. Allow the patient and you to rest momentarily and then repeat the maneuver.